Yep. Okay, now I will, thank you, Hernie. Now I will invite Ms. Dia to present the TNP2K view and implementation of program related to elderly vulnerability and social protection. Please do.
Yeah. Thank you very much for Maria. So hello everybody. I hope that everyone is doing great and healthy and happy. So first of all, I would like to say thank you very much for the opportunity of speaking in this webinar. Very important and dearly topic for us at TNP2K, protecting the elderly, especially during the COVID-19 pandemic, which organized by Prakarsa. So I will basically be speaking today on the elderly in Indonesia, their vulnerability and social protection for them, which that already existed, and what kind of social protection that the government has during the COVID-19 pandemic. So it will consist of 4 different sections. I promise I will be brief in sharing some of the analysis and recommendation. So next slide. So in this slide is basically just a brief historical information on the start of the virus. But I'm sure that everybody has already known that this pandemic continues to spread and has already infected more than 2 million people globally, with a fatality rate more than 150,000, but 500,000 already recovered. And in Indonesia, COVID-19, I think, reached officially early in March. And now by mid of April, all provinces have already reported for the virus spread. So for Indonesia, as of yesterday, I think more than 6,000 people have tested positive. Our recovery rate is about 10%, and the fatality rate is about 8 to 9%. So next slide. So as everyone knows that all ages basically can be infected by this virus. But for the old people or anyone with pre-existing medical conditions such as diabetes, high blood pressure, and other disease, they appear to be more vulnerable to contract with the virus. So this pandemic is actually threatened Indonesia health system, economy, and also social affiliation. So all segments of the population has been affected at some level. However, some specific group, including children, the elderly, and people with disability, are also more vulnerable as compared to the others. So with this unprecedented impact, I think it is important for any government to quickly assess and identify which vulnerable groups in their society who are more at risk, and come up with a fast solution, not only to slow the spread of the virus, but also to provide comprehensive protection or compensation package for its citizens. So briefly, in these 2 slides, it's basically just a short assessment of identification of affected group due to the virus, impact, assessment on the existing coverage, question on sustainability. Basically, the objective is to provide a framework to maximize protection during this pandemic. Next slide. So for the briefly for this section, I will provide a brief overview of elderly vulnerability before and during the pandemic. So based on our analysis using the 2018 database, currently 2019, there's about 9% or more than 24 million elderly here in Indonesia, where around 11 millions of them are coming from the bottom 40%. And half of them are female. Next. And Indonesia is also state of becoming an aging society, where by 2050, I think it is estimated that around 21% or more will be considered elderly. That includes maybe some of us here, including me. So next. Even before the pandemic, Indonesia elderly has already experienced a growing risk and challenges such as declining health status, becoming disabled. They might have limited or no income at all, as well as limited or no old age security in the forms of pension. And on top of that, when we assess the poverty rate based on age group, our elderly is one of the most vulnerable groups with the highest poverty rate. So they already have a lot of risk and vulnerability. Next slide. And if you can see here, also our analysis shows that a lot of our elderly continues to work in their old age, despite some of their limitation. And next one. The next slide is based on our analysis, we can also see that a lot of Indonesia elderly still live with their children as well as grandchildren, because there's a local belief that elderly care should fall within the family. But we think that it's a challenge in reality for elderly living with their children who may also have a limited income or no income at all during the pandemic. Next. So we also analyze the pension ownership. So basically, ideally, everybody should have some old age saving. But here, based on our analysis, those who can have pension is those coming from more affluent group, so the high decile. Next. So with even before the pandemic and now with this pandemic, it has increased the risk and vulnerabilities of our elderly population, especially such as with the limited mobility, because there's a policy to stay at home, so they might have difficulties in accessing basic services such as health services, and they might also experience economic shock, and there is a possibility of social exclusion and other risk factors. So next. So this is briefly on the social protection and what kind of stimulus that the government has. So next, like earlier, we already have some protection for our elderly in the form of social assistance or the non-contributory, which is elderly under program Keluarga Harapan. I think the coverage is about 1.1 million. And we also have a smaller program called Bantu LU, or social assistance for elderly, that reach about 30,000. Elderly, and there's also a social insurance, but mostly it only reach the government official or military pensioner. But through the BPJS employment, currently there's more than 17 million are contributing for their old age saving. And for the health insurance, I think more than 20 million of our elderly has already covered by the health coverage insurance. Next. So this is just briefly to give an overview of what kind of economic stimulus policy that the government has already budgeted because of this pandemic. In total, I think about 35 billion US dollar. So that's probably about 2.5 or 3% of our GDP. And so the next one, the last one, next slide. So the third economic stimulus is where about 6.7 billion has already invested to provide some social safety net or social protection. Next. So this is just to give you a detail what kind of social assistance that the government has provided, from adding the number of those receiving food assistance and also PKH and also subsidized contributory for the health insurance, for the third class premium, and free electricity for those with 450 kilowatts. So but basically this is for families. So it's not, it is important for us, ideally, when we want to provide social assistance or protection to the elderly, it has to go through the individual elderly instead of through the family. But at the moment, unfortunately, our existing program is designed mostly for the family. Next. So this is, next slide. So this is our recommendation of what we can do in this to reduce the vulnerability of our elderly during this pandemic. So ideally, with the speed of the virus transmission, it is crucial for any relief policy or programs to reduce the risk for impacted population, including the elderly, to be for everyone, like Prakarsa mentioned earlier. So it's ideally be universal, and it has to be comprehensive and integrated with other existing programs. It needs to be fast, simple, and timely delivery. So, before, can we go back to the previous slide? So this is, we already have 2 programs, so maybe we could gradually expand the existing programs such as Bantu LU, then expand for the elderly beneficiary under PKH. I think for now, those who are 70 plus years are still not yet covered by PKH. And if we have some physical space, we can also provide, if we have the physical space, we can provide a temporary universal transfer for the elderly. So next one. So this is just the calculation, like how much that we would need if we want, for example, to cover 24 all of the elderly above 60 plus years. So probably it will need a budget of 14 trillion rupiah. If it's for all elderly, by giving a benefit values of 200,000 per month for the next 3 months. Or we can also start with those who are 70 plus years, which is now around 8.9 million elderly. With less budget, maybe we can cover more. Next one. So in addition to our recommendation, I think it would be able to mitigate some of the impact of this pandemic. And my final words, whichever options are adopted by the government, any type of support for vulnerable groups, including the elderly, needs to incorporate features such as earlier I mentioned. It has to be fast, simple, comprehensive. And ideally, like if we can do a new program, we can expand or scale up existing program. And we can also employ a risk-sharing approach where if fiscal resources are limited, for example, the central and local government can have a partnership or collaborate with private sectors, NGOs, development partner, etc. So I think that's it from me. So thank you for listening. I hope these are useful. So look forward for your question and feedback. Thank you.
Thank you very much, Mbak Dia, for your timely presentations. You are more quickly 3 minutes, so that we're very grateful for that. And now I would like to invite the experience from the Philippines, from our counterpart, COSE.
Okay.
Yeah, I'll open your PowerPoint. Yes, please, Roselle.
Okay. Good afternoon, everyone. Again, my name is Rochelle Green from the Coalition of Services of the Elderly. And today I'm going to share with you some of the Philippine government's measures in protecting the older persons amidst this pandemic. And here's the outline. Next slide, please. The outline of my presentation, just to give you an idea what I'm going to discuss in the next 10 or more minutes. First is a short background on what COSE is, and second, of course, is the current situation on the data of confirmed cases and recorded deaths here in the Philippines. Third is the impact of COVID-19 to older persons. Fourth is the sum of the government measures, both from the national and local government units. And of course, the identified gaps by the COSE. And number 6 are the COSE's recommendations on how to ensure and keep older persons protected during and even after the COVID-19. Next. Briefly, the Coalition of Services of the Elderly is a non-government organization working with older persons in the Philippines since 1989 in addressing the issues of poverty, exclusion, and invisibility. And responding to these issues will ensure that all generations of Filipinos will have more secure aging. And 2 of the notable policies successfully lobbied, are the social pension for the indigent senior citizens and the mandatory PhilHealth coverage for all senior citizens. Next slide, please. And just to give you a short background, as of April 19, 2020, there are 1,884 older persons, or 30% of the 6,259 total confirmed cases of COVID-19 are older persons. And of the 409 recorded deaths, 287 or 68% are 60 years old or above, and 3 in 5 reported deaths are older persons, which means that they are not only susceptible to coronaviruses, but at higher risk for severe diseases and death. Next. Although we have no specific data at COSE as of now as to how many older persons are affected, but given that the enhanced community quarantine is nationwide, we are assuming at COSE that the 7.5 million of older persons as of the Philippines Statistics Authority 2015 census, the affected economically and in terms of health are all of the senior citizens. And of the impact of COVID-19 older persons' health first is the limited or low access to health services. There's this data from the longitudinal study of aging and health in the Philippines conducted in 2019 shows that 1 in 5 older persons have an unmet need for medical care because of financial reasons. Take note, this is before COVID-19 data. With enhanced community quarantine, older persons' economic activities are temporarily stopped and movements outside the house are limited. This data probably have gone higher. Next is second, the discrimination against older persons. Back to the previous slide, please. Second is the discrimination against older persons or the ageism. Last week, previous slide is. Last week, the report about a 65-year-old man who died at home after being rejected by 6 hospitals was depressing. Such way or treatment of some hospital and healthcare workers to senior citizens, simply implying that it's okay for older persons to get sick and just die because of their age is very alarming. Fortunately, this incident caught the attention of President Rodrigo Duterte, the President of the Philippines, and warned officials of government hospitals of dismissal or suspension if they have found to have rejected any patients. This is just one of the cases of discrimination against older persons during this COVID-19 crisis. While there are already policies or guidelines against discrimination of patients, these are not being implemented or followed well. And we at COSE, while we appreciate and thanks, of course, all the frontliners, sadly to say, some healthcare providers are the ones violating the set guidelines and discriminating the older persons. Next, please. The crisis has put older persons' lives and economic status in a more difficult situation. With the crisis, their vulnerability doubled or more because of first, work suspension. Again, data from the longitudinal study of aging and health in the Philippines in 2019, 34% of older persons receive earnings from work. Income from work means salaries in wages from being a farm worker. But with the enhanced community quarantine, economic activities, if not limited, are suspended. Thus, for the older persons from the informal sectors, where their jobs do not even guarantee a good and stable income, a day without an earning makes their lives more impoverished, which could lead to depression and again, poorer health condition. Second is the temporary suspension of financial support from children. Due to the COVID-19 crisis, older persons' children are also affected due to the no work, no pay scheme. And there's also this freezing of remittances from children working overseas. And at times like this, for older persons who are relying on financial support from their children, the question actually is who will provide for their needs. Another is the low pension coverage and benefit. Although the social pension program of the Philippine government has been being implemented since 2011, the benefit, which is 500 pesos monthly or around 10 US dollar or 3,000 or around 59 US dollar per semester or 6 months as of April 19 exchange rate, though very small amount, it would augment the daily needs of the social pensioners. However, this small amount the social pensioners had been waiting for that could help them support their basic needs during this crisis has not delivered yet, thus making the lives of the almost 3.8 million social pension beneficiaries more economically vulnerable. Next slide, please. And since the order of the enhanced community quarantine on March 16, several efforts and interventions have been initiated by the national and local government units, including the private sectors, non-government organizations, to help older persons, especially, of course, the most vulnerable. And some of the national government measures and responses are the following. First is the Social Amelioration Program. It is the 200 billion pesos program for distribution in cash between 5,000 to 8,000 pesos, or around 98 to 157 US dollars, again, based on the April 19, 2020 currency exchange rate. And of course, the amount depends on a minimum wage per area. And recipient of this program is the 18 million low-income Filipino families or vulnerable sectors of society, such as persons with disabilities and, of course, senior citizens, pregnant mothers, homeless persons, and workers in informal sectors who have been affected by the community quarantine amid the COVID-19 crisis, as mandated by the Republic Act 11469, or the Bayanihan to Heal as One Act, signed by President Rodrigo Duterte on March 24, 2020. Another is the prioritization of senior citizens in the testing for COVID-19, as well, of course, as the pregnant women and individuals with underlying medical conditions showing symptoms, even if it's just mild to moderate. Next slide, please. And some of the local government units measures and responses to protect older persons and keep them safe during this crisis are following. First is making programs and services more accessible. Example here is the mobile palengke or mobile market in different cities and municipalities. These actually alternative mobile markets are set for citizens, including the senior citizens, of course, to purchase commodities without risking COVID-19 infection from crowded spaces. Second is the provision of temporary shelter for homeless older persons. The modular tents are actually set up inside gymnasiums that turn into a temporary shelter for homeless people, including older persons. Another is the Anti-COVID-19 Discrimination Ordinance of 2020, or the Ordinance number 8642 of the City of Manila, here in Metro Manila, which also welcome as a good initiative during this crisis where older persons still suffer from discrimination. Next slide, please. There's also this door-to-door delivery of senior citizens' medicines in one of the cities here in Metro Manila, where barangay health workers are making rounds to deliver door-to-door the medicines of the Nabota city's senior citizens to prevent them from the risk of going out. Because as we all know, senior citizens are the more vulnerable in this crisis. Another is the cash assistance in Makati City. Senior citizens will receive their mid-year cash gift in food packs and will be delivered directly to their homes. Although this program is under the Blue Card program of the city, the municipal mayor said that the move is the local government unit's way of easing the anxiety of its senior citizens amid the coronavirus disease. And six is the provision of food and non-food items in terms of vitamins, rice, noodles, canned goods, vegetables, and etc. Next slide, please. The Coalition of Services of the Elderly appreciates, of course, the different programs and measures continuously being done by the national and local government units. However, there are still some gaps in addressing today's crisis and in making sure, of course, that older persons are safe and protected. And COSE identified the following. Number one is the targeting errors in the social amelioration program that lead to exclusion of the following senior citizens. First is the exclusion of senior citizens with pension. And based on the Philippine Social Security System, or SSS, and of the Government Service Insurance System, or GSIS, administrative data in 2018, 3 out of 4 of SSS pensioners, or 75%, and 24.1% of GSIS pensioners receive 5,000 or around 98 US dollar. and below pension. Because of their meager pensions, they continue to work mostly in the informal sectors and or are relying on their children for support. However, as I have mentioned earlier, older persons' economic activities, if not limited, are cancelled, and support from children are temporarily stopped with uncertainty when to resume, as many daily works are suspended since the pronouncement of the enhanced community quarantine. Another is the exclusion of senior citizens with social pension. However, according to Republic Act 1994 or the expanded Senior Citizens Act of 2010, the social pension is to augment the needs of the poor senior citizens, and it's not designed for a crisis like this. And the delay of the release of social pension is simply appalling, and its release should in no way be treated as part of the social amelioration package, but as for older persons' long overdue and unfulfilled rights. Another is the exclusion of senior citizens with children working domestically abroad in the social amelioration program. But even before the crisis, the 3.8 million indigent Filipino senior citizens already are suffering from poverty and have difficulty meeting their daily needs. However, their economic vulnerability, especially of the most older women, has most likely worsened since economic activities, mostly informal works, and their children are also affected because of the lockdown and again of the freezing of remittances. And another identified gap is the delayed payment of social pension. Although the social protection program has been being implemented since 2011, as I have mentioned earlier, COSE supports the decision of the Department of Social Welfare and Development to continue the implementation of the social pension for indigent senior citizens, as stated in its Memorandum Circular Number 4, Series of 2020, correcting the initial report on the temporary suspension of the program due to COVID-19. The amount that social pensioners could rely on for their basic daily needs at this time of crisis has not been delivered yet. As of March 6, 2020, there are still more than 900 unpaid social pensioners for 2019 benefit. Although there are already reports that the benefit will soon be paid, including the social pension for the first 6 months of 2020, amounting to 3,000 pesos or around 59 US dollar. No exact date has mentioned yet. Another slide, please. The concerns of older persons will not end actually after the quarantine period is over. Another set of problems will set to begin, and the older person's issues and concerns will remain there and their families concerned. And the few organizations working with and for the older persons should the present issues not be tackled and addressed. And seen the measures and responses of the national and local government units, and of course the gaps. That's why COSE, as an organization working with and for the sector of the elderly, recommends the following that will benefit older persons, especially the most vulnerable during and even after this crisis. First is to ensure basic income for older persons through the social amelioration program by automatically including all families living with older persons regardless of their economic and pension status. And of course, prioritize older persons living with spouses only, those living alone and homeless. And worrying with this program could be released or if they are included or not, cause undue stress that can lead to depression or worsen their health condition. And of course, through the immediate delivery of the social pension benefit. Another recommendation is with the increasing number of positive COVID-19 here in the Philippines, we are not certain if the quarantine will be extended or not. Thus, we at COSE recommend universal social pension. We've been actually campaigning for the passage of this since 2016, and there are already several bills filed both in Senate and the Congress to amend the social pension provisions of the Republic Act 1994 or the Expanded Senior Citizens Act 2010. And COSE believes that it's actually the right time to give the current social pension a genuine reform to give older persons a life with dignity. And this, of course, will give and ensure older persons basic income, again, not just during this crisis, but even after. And of course, the age-friendly healthcare to end ageism and discrimination against older persons. And we at POSE want to emphasize that the safety of older persons is everyone's concern, yet the government is accountable for protecting and ensuring their welfare and well-being as members of society, and making and keeping older persons protected and safe at all times, especially during this crisis, is one way of measuring how effective the government measures are in battling with the COVID-19. That's like this. And I want to end my presentation by sharing this statement of a 70-year-old woman, quote, prioritize and ensure the inclusion of all older women and men in the government programs and services, not just in the guidelines, but more importantly, on the actual implementation. And please don't make us feel that in this battle, we are being neglected and alone, unquote. Thank you, and again, good afternoon, everyone.
Yeah.
Oh, sorry. So yeah, after we have listened to these interesting presentations from the Indonesia and Philippines experience and recommendations, I would like to invite Professor Whiteford to talk about the perspective from the OECD or Australian, from the international perspective about the elderly, protecting elderly populations in the age of the pandemic of COVID-19. Please, Professor Whiteford.
Thank you very much for the opportunity to talk to you. I think I want to talk in sort of fairly general terms to start off with. And I think that what's really striking about the situation facing the world and all its countries is the complexity of the public policy challenges and also the speed of change that has occurred. I don't know about you, but I spent about the last month at home, so it sort of seems like, at one level, it sort of seems interminable, but at the same time, every day when I turn on the news at the end of the day, something astonishing has happened somewhere. So it's sort of this combination of not feeling as if many things are happening in your own life, but in the world, there's an awful lot of things happening. And I think it's fair to say that for high-income countries, as for everywhere else, as I said, this is an incredibly complex combination of challenges. But first and foremost, particularly at the moment, and I think for the foreseeable future, it's a public health challenge. And that's where the countries that are, at the moment anyway, are doing better have focused. So they're focused on maintaining and directing their policy directions towards public health. And that, of course, in Australia, it's been labelled social distancing. That is, sort of that essentially all places of entertainment, hotels, cafes, restaurants, most coffee shops have been closed down, and when you walk, you're supposed to sort of keep your distance, and most people are encouraged to stay home as much as possible, and go out and get some exercise, but certainly no major groups. Now, as I said, there's also the speed of change. I'm currently involved in an internet. I'll be co-editing a special issue of an international journal on the social policy responses across OECD countries, but also across a range of Asian countries as well, to the COVID-19 pandemic. But we don't have any results yet. Sort of the papers will be written in July, and it's by July, and it's very much a developing agenda. but I do know a little bit about a range of countries. Now, just to give you some context, at the moment, Australia appears to have been one of the more successful countries in terms of controlling the outbreak. That's because we're largely one big island. There's actually another one, of course, to the south of Australia, and that therefore we've been able to stop international travel. So there've been about I think they've found so far about in Australia has roughly a population of 25 million. There's about 6,600 confirmed cases, but about 2/3 of those people have recovered, and only, I mean, it's not only for the people and their families, obviously, but about 71 people have died. So that's much, much lower than most countries in Europe. But it's, as I said, it's basically because effectively we're able to quarantine the country, and we're also testing at quite a high rate. So there are about 420,000 people have been tested, and the testing and tracing of the connections is widely regarded here as being the crucial elements in controlling the spread of the virus. Now, rather similarly to Indonesia, we've had three stimulus packages. As I said, things developed very quickly, and while I'm not directly involved in government, observing what they've done externally, it seems to me pretty clear that on the whole, they've been making it up as they go along. Yeah, they have had the ability to respond quickly and change direction, and they've done it. But I think if one looks back, say, 6 weeks ago, I don't think they had any idea that they were going to be doing the things they've done. So it's sort of, sort of the necessity to sort of really be able to revise your plans at short notice is crucial. So the first stimulus package that we had was really, it involves support for businesses. So basically loans or grants of up to $20,000 for small business. There's about, I think, as Herney suggested, $1 Australian is roughly a bit under 10,000 rupiah, I think is the number. But what we also did in the first package, which was announced about in early March, was the government sent cheques of $750 per person to about 6 million households, and basically they were people who were already receiving either payments because they were over the age of 65, or they had a disability, or they were unemployed, or they were caring for somebody with disability, but also to families with children. So we sent out $750 cheques, but having said that, they've only just literally been paid in the last 2 or 3 weeks starting. So it took 3 weeks for them to start to be paid. But then very shortly afterwards, well, a couple of weeks afterwards, they, sort of the real impact in Australia in terms of economic well-being have been on people of working age, basically because sort of the social distancing basically has sort of caused havoc amongst a large part of the working age workforce. In Australia, there are obviously people over the age of 65 who are working, but it's much lower. What's happened is that we actually just earlier today had the first figures from our Bureau of Statistics on what's happened to employment over the last month, And about a month ago, there were about, of people aged 18 and over, about 64% were actually working. In the middle of this month, about a week ago, it had fallen to 56%. So it's gone from 8% of the population in the space of a month have stopped having any hours of paid work, and a lot of other people have reduced their hours of paid work as well. About 26% have reduced their hours of paid work. So it's a massive economic impact, which we really haven't been able to quantify yet in terms of what it means in terms of recessions in a very short period of time. And I think one of the things that unfortunately will become obvious everywhere is that a massive economic impact is unavoidable. It's not just that in Australia that we've said, sort of a lot of businesses effectively have to close down or go into hibernation, as we say. But clearly, it started with sort of the economic impact in China. It moved throughout other Asian countries. It's moved to Europe and North America. So the world is going to have a big recession, if not a depression. And I think that is unavoidable. The second stimulus package that the government announced was quite extraordinary in relation to its previous policy settings, and that is that for the next 6 months, we've effectively doubled the rate of payment that we give for people who are unemployed or who of working age and who are sort of expected to look for work. Excuse me a second. But the other thing that we did was very important, and it relates, I think, to some of the issues that have been raised already, is that we significantly reduced the conditionality in the system. So while we don't have conditional cash transfers per se, some are more conditional than others, generally speaking, we have asset tests and we have waiting periods for benefits. So for 6 months, those waiting periods have been completely suspended. The asset tests that we have for payments have also been completely suspended. So it doesn't matter how much savings you have. If you lose your job, you're eligible to receive one of these payments. So I think the reducing conditionality as a way of facilitating people's entry into the system and trying to reduce the administrative barriers to receiving help is a very important thing to think about. I mean, those payments, even though that was announced more than a month ago, they're only probably just starting to be paid. But what happened after they announced that increase, and they also then the same day effectively announced a lot of, sort of closing down of social life, is that the number of people claiming benefits skyrocketed very quickly. So then a week later, the government introduced a further package, which was much more generous, basically subsidising employers to keep their workers attached to their workforce. So that rather than becoming unemployed, even if they weren't working, they would get actually about $1,500 per fortnight Australian, the same amount paid to everybody, so long as there was a downturn in business of 30% or more, and more if you're a business. And that cost about 130 billion Australian dollars, which is more than we spend on social security in total in Australia. So even that's not a social security benefit because it gets paid to employers to keep the workers employed. When you put together all the packages and the sort of the financial support for business, the stimulus, the three packages we've had come up to about 10% of GDP. Now, you'll have noticed that I haven't said very much about the elderly in this yet, and that's because the policy is very much, in terms of cash payments, is about assisting people of working age who have either lost their employment or had to reduce their hours. Essentially, that's because Australia already had effectively just about all poor people over the age of 65 covered by government benefits. So we have what we call the age pension, which is based on residence. So you just have to have lived in the country for 10 years, and it also helps if you're a citizen, but basically you have to have 10 years of permanent residence. It doesn't require any contributions. It is income tested. And while it's not, it pays per person about 24,000 Australian dollars a year. So as a safety net, it's pretty good. But there've been virtually no initiatives to increase that, and there's some debate about that. So the issue, probably in most, in Australia certainly, and in a lot of other high-income countries or OECD countries where there's existing safety nets for the elderly, is not so much about income support. It's about protection from the health risks of COVID-19, and certainly of the 71 people who died in Australia since the pandemic struck, I think all but about 3 are over the age of 60, or mostly over the age of 70. So the focus here is very much on protecting the health of elderly people and protecting the economic conditions of younger people. Now, that reflects both our existing circumstances and the fact that we have a sort of a quite wide safety net for elderly people. But there's a lot of other impacts that are not necessarily measured in financial terms. So, there's this pretty clearly, while there's no particular, specific rules about isolation of elderly people, one of the impacts has been particularly in relation to elderly people seeing their grandchildren and their own children. So that's generally not encouraged at all. So there's concerns about social isolation. There's also been very significant concerns about Indigenous people in Australia. So our Aboriginal population, basically, by their 50s, they have the sort of health circumstances of other Australians in their 70s. So they have sort of all the risks. They have all the health risks at a much earlier age. Now, so far, because of basically because of isolation of those communities, which are in very remote areas, and also enforced isolation between states, there doesn't seem to have been a breakout of problems there, but there's obviously very significant risks if the pandemic gets out to those communities. I think that sort of at the moment, Australia's almost reached the stage where we're discussing how we come out of this. Now, there's a lot of debate about it, whether, as in the United States, we have some people who think that the economic burden on younger people is so high that we need to, not be so worried about infections. The government, I think, very wisely has decided not to go down that path, that we're still focusing on suppression, if not complete elimination. New Zealand has tried to completely eliminate. Now, yeah, the situation obviously is that remote countries which are islands like Australia and New Zealand can much better control this than, yeah, if we didn't have it in the first place, then other circumstances, then, you know, you couldn't in Indonesia or the Philippines. But having said that, you know, sort of one of the things that seems to me to be a potential lesson is, can you isolate, you know, although I think I saw in one of the charts that there are many cases in many parts of Indonesia already. But to the extent that you can actually stop it spreading to other islands or parts of the country, that's obviously going to be very important. But I think in terms of, because of course, while in this talk I've focused on what they've done for working age people, yeah, sort of that's very important for the economy, basically. You know, that it's and which is what supports elderly people as well. And I don't know whether Indonesia or the Philippines have thought about, you know, how you support vulnerable working age people. Now, yeah, we've got much greater fiscal capacity, and we can talk about that later. But you know, even so, about a quarter of people in work in Australia are what we call casuals, which means that they don't get paid sick leave. They get a slightly higher hourly rate, but they're much easier to dismiss than other workers. And so they're not informal, but they're in Australian terms, they're closer to informal workers than elsewhere. And also about 13% of the workforce are self-employed. And of course, because they don't have paid sick leave, they have to, yeah, save up for this to support their sick leave. So yeah, sort of trying to work out. So the challenge in Australia, and I think in a lot of European countries and America and in Britain, has been trying to work out how to keep incomes going into working age households. And I don't know, so even though that's sort of a bit different from the focus of this this discussion, I think it does have important implications for thinking about how you yeah, going forward, how you protect the vulnerable elderly. Our focus in Australia in terms of protecting the vulnerable elderly is on the health system and making sure that that continues to manage. I mean, the real reason for the social distancing, etc., I think, is mainly to make sure that that we have a functioning healthcare system. Now, the challenges in Indonesia are obviously going to be much greater than they are in Australia. So I'll stop there, and I'm happy to, you know, sort of elaborate on anything that sounds pertinent to you.
Thank you, Professor Whiteford. And I will like to have probably 1 minute of recap of all speakers' talks today. I think what we have is similarity between the Indonesian context and the Philippines context are we have at least 5 points where seems like universal scheme is highly on demand, but of course, like in other social policies, we always have a problem with fiscal capacity. So that's probably one of the challenge for this getting all the social policy measures to tackle this pandemic economic problems within the fiscal capacity of countries like Indonesia and the Philippines. And the second is the high informality of the workforce, both in Indonesia and the Philippines, which will also lead to the problem of how fragmented is the social protection measures, policy measures that we have in developing countries in general, because with all different categories of things, the government must use different channels, and therefore the fragmented kind of social policy measures. Also the gaps and differences between and cooperation. I think this we will share with also Australian context, where the federal government and the state governments have a different level of responsibilities, and that's also what we see in the presentations in the Philippines and Indonesian context, where the national government has different kind of policies, and the local governments up down to the community level, they have the breakdown of the measures to tackle pandemic. And one last thing is the absence of pension systems, which is very stark difference between the OECD countries and countries like Indonesia and Philippines, where we don't have such thing, and high reliance on family. It's still presumed to be common demands from elderly people and the family, but from Prakarsa's research, we can see that it's quite no longer the situation. And also, Mbak Dia from TNP 2K also challenged this, because the high economic burden to the family, and also the older people themselves would prefer to share their burden among their age cohort, which something that is a big problem in developing countries because of the absence of aged care facilities, unlike in Australia, for instance, which policy can be targeted specific during pandemic to the aged care facilities. Yeah, and social exclusions probably suffered by most of the elderly people in both settings. And now I would like to go to this question. We have 3 questions already. I would